with the community, public at large, that as we move through our first phase of recovery and as we continue to make progress or not, we're going to be very upfront about sharing the data and providing you with the information that we have and also that we use to therefore make decisions. And so we are now into really over 2 weeks, close to being, from the start of phase one. You know, we went into phase one on May the 16th at 6 a.m. in the morning. And I want to continue to thank the public for responding to the mandates, to the proclamation that the City of New Orleans has had in place. We appreciate you. We cannot get through without you. And we've gotten to this point, again, by having people adhere to the guidance that we put forward. We want to continue on that path so that we do not regress, but we continue to make progress as a city. I'm joined here this morning, our fierce leader, on the line, front line, unwavering, and that is Dr. Jennifer Avegno, who is our director of the New Orleans Health Department. Thank you, Dr. Avegno. It's always, every chance I get to say it publicly, I'm going to keep on bringing it on because it's your leadership that's getting us and getting things done in the city. Dr. Avegno will walk you through a breakdown of the data, much like she did on May the 15th, prior to us moving forward with opening the city. As of yesterday, the City of New Orleans had 7,067 positive cases, 505 deaths in our city. Our hearts continue to go out to our residents who've been impacted by those losses in our community. I do have to say, I received, the first time I received the list of all of our residents who have succumbed to COVID-19, I kind of lost it. Very emotional. Normally when we get the information, it comes in numbers, so you get the number. But when I received for the first time the package from our first death through this particular data set was through May 2nd. It really changed me a little bit. Not that my heart wasn't fluttered, and as it relates to the losses that we witnessed in our community, but seeing it on paper with the names of our people, where they live, their date of birth, the last breath that they took that particular date, their race, their age, it crystallized it all for me. They were human beings, and they were on the front line of this virus, and we've lost them, and we will never get them back. But their memory and their lives will not be in vain, because we will hold them deep in our hearts as we move through and fully recover in the City of New Orleans. One of the first things I said when I had it in my hand, and our Deputy CEO, Ramsey Green, stepped in my office, and he saw my little tears, and not a little, I would say, but he saw my tears, and the first thing I said, Ramsey, I said, we're talking about capital projects and investing in the city, but we have to have a memorial for our people. And so I just want our families to know that your loved ones will never be forgotten in the City of New Orleans. Our response has been guided by our operating principle. We will focus on the data and not the date. We have been and will continue to be transparent, as I mentioned at the start of this press conference. We are only again in week 2 of phase 1. We have yet to see the impacts of our busy weekend of Memorial Day that just passed, where we saw large gatherings throughout the city, but mostly in surrounding areas and surrounding states that abut us. So we're going to be looking, of course, at that data and moving through swiftly. The data impacts how we will continue to reopen the City of New Orleans, loosen the restrictions moving forward, to move into phase 2, we have to ensure that we are hitting all of the appropriate milestones. So whether that is our testing capacity, which we have increased significantly, but we've always been ahead of the game in our community as it relates to testing. But again, meeting people where they are, being intentional about where we go, those mobile testing sites, hitting our Latino and Hispanic community, proven to be effective. The healthcare capacity, again, in our city, making sure that it continues to be, that capacity continues to be available and keeping up with the need every single day. That we are not seeing dramatic spikes or moving back into community spread because we've come so gracefully out of that community spread, but we need to see and continue to see the decline of new cases. Contact tracing in place. Just signed the cooperative endeavor agreement with the state of Louisiana, LDH, that ensures that the city of New Orleans gets timely information and that information is shared with us so that, again, it will drive our decisions as it relates to looking at that data, seeing how well we're doing so that we can continue to demonstrate that public health is our top priority. Public health is public safety. Public health is tied to our economy. And with that, that we emerge out of this crisis as a community that is safe, not only for the people who live here, but those who visit, who are looking to return to the city of New Orleans. And we're looking forward to welcoming you here, but with public health being that top priority, we want to make sure that we can take care of you. And I am absolutely confident in our ability to do so and how we've been moving out of this pandemic through recovery. Again, proud of our people, cannot say it enough. I'm proud of you and very thankful for you because you're the only way that we're going to continue. You've helped us flatten that curve. We want to stay moving forward. We have stopped the spread. We do not want to regress, and the only way we stay on the track is to continue to follow the guidelines that is set by the city of New Orleans. So with that, I'm going to bring up Dr. Avegno, who will do more than I could ever do. And thank you again for your leadership, Doc, and I love your hair. Thank you.
Thank you, Mayor. It really is an honor to serve. I'm very grateful for the opportunity. I'm grateful for your leadership. I am grateful to be in an administration that does care so deeply about its people. What I want to do today is sort of a corollary to what I did a few weeks ago, because I think it's important to put context to the numbers. The vast majority of what you're going to see here is available publicly every day, all day at NOLA Ready, and so I'm hoping that people are following along. But I think sometimes numbers need a little bit of explanation and clarification just to really crystallize what their meaning is. We are now in phase 1 for about 2 weeks, and I will mention, yes, as the mayor noticed, I did get a haircut. I was very excited to participate in this phase 1 activity. It was a wonderful socially distant experience. I was the only person in the salon. We had full mask and glove and PPE. So I'm grateful that hopefully many of us can have that experience if they haven't already. Here's where we are today, as the mayor said. You can see how that curve looked. You can see how steep we were climbing. This is new cases per day, and how really in the last many weeks we have had a much, much slower increase. When we first looked at our models when this all began, as you've heard me say, we estimated in 8 weeks that if we had done nothing, if we had put no measures in place, that there would have been at least 1,300 people dead. The fact that we have 505 is a tragedy. These are 505 individuals that would still be alive today. But the fact that we don't have 1,300 is an incredible testament to what the city of New Orleans has done. And I'm continue to be proud of that. And that's really our goal, to minimize that loss of life. Next slide. This is the curve that everybody talks about. What we're looking at is new cases per day. and averaged over a week. Because as we know, the number of cases on a particular day might fluctuate, whether it was a weekend that's being reported, whether there might have been some data transfer issues, whether we did 1,000 tests that day or 500 tests that day. So one day does not give us a clear picture. But when you average it out, you see some really clear trends. Almost exactly 3 weeks to the day that we implemented our stay-at-home order was when we saw our peak. And again, you've heard me talk about viral transmission. We know, as we're beginning to understand this virus more, that it can take up to 2 to 3 weeks for an infected person to pass it on to other people and for them to show symptoms. So it's a very long timeline that we wait to see the effect. So in the weeks before our stay-at-home measures, that's when we know people were getting infected, and that resulted in our peak. So the takeaway is really when you do something, when you either put measures in place or you walk them back, you need at least 3 weeks to understand what's going to happen. You can see where our peak was, where we were at that point seeing over 400 new cases every day. And you can see how far we've come from that. You can see where phase 1 started. That was May 15th, 16th. That's almost 2 weeks. And then you can see we're just sort of at the a few days post-Memorial Day. We've tested almost 45. By today, it'll be 45,000 people just in the city of New Orleans. That's over 11% of our population. Those are numbers that other cities envy because they have not been able to sustain that level of testing. And so I thank everyone that has come out to our mobile testing sites. I thank our partners with LCMC, LSU, Core Foundation, Ochsner, because it's because of them that we're doing this, and we want to keep it up. Our goal is to test everybody, or the equivalent of our entire population in the city of New Orleans. Next slide. When we talked about moving forward, we presented milestones, and again, all of this is available on NOLA Ready. Our first milestone was that sustained decrease in new cases. We are continuing to see this. 2 weeks after our stay-at-home, we're continuing to see low numbers, and that's something to be proud of. But remember, we're not expecting yet to see any results of what happened when we loosened for at least another week. So while we're confident that things haven't spiked immediately, we still need a little bit more time. I will say, along with our cases being low, when we do go out and test, the percent of tests that are positive is right about 3%. Again, this is an enviable goal. When I talk to my colleagues in places like Chicago and D.C., whose state governments are thinking of reopening today, they're hitting positive rates of 15 and 20%. That would cause me great concern if we were 15 and 20%. At 3%, I'm very confident that the spread is quite low in the population. Next slide. Again, I can't say enough about our testing. We need to hit a little over 500 to meet the federal benchmarks. We're averaging over 700, and this week I think it's been over 800 cases a day. We are doing the testing we need. We are doing it in the places that we need. We are using that data to target where we need to go next. When we see a hotspot, we plan a testing site. We are going to bring on more testing availability through United Health and another partnership with the Louisiana Department of Health. So these numbers will continue to grow. In terms of contact tracing, there's been a lot of talk about that. The state is on its way to hitting its goal of 700 contact tracers. They had hired 380 as of earlier this week. I suspect that it's more than that as of today. I think we've talked about it enough. Everyone should know how it works, and as the mayor said, we're really happy that we will be getting some information on just the ability to contact people in New Orleans, challenges that LDH is having, and that will allow us to best support them in making sure that this is really a closed loop of identifying cases, isolating them, and preventing spread to contacts. This is a busy slide, but you can see it in more detail on NOLA Ready. Our hospital's capacity remains robust. That's the moral of that story. We continue to have regular beds available, ICU beds available, plenty of ventilators available. Again, our ERs are not back up at capacity. There is capacity. They're doing a fantastic job of testing almost everybody who walks into the ER for any reason. So we have a really good sense of, who needs PPE and who does not. And they're completely able to care for every other regular emergency that we always could. So I feel very, very confident in our hospital and healthcare system. We also have our industry-specific guidelines in place. The whole goal of the slow reopening, the phased reopening, was to prevent against a spike, so to make sure that businesses that were reopening were doing it in the safest manner, and then to avoid high-risk events, activities, businesses that we know cause a large number of cases and are very difficult to control. If you are a business that's been allowed to reopen in some capacity in phase 1, you will have had to go to the state fire marshal to register. I think that process is very easy. The guidelines there are very complete. And every place, as I sort of do my limited going around the city, I've been very impressed with how people are following it, and in some cases even exceeding it, taking it further to give extra protections to their customers. One of the things that we've talked about before and that we try to measure is this concept of the R0. So how infectious is the disease? Remember, our goal is to keep the R0 below 1. And what that means is that if one person has COVID, they only transmit to one other person. That keeps the spread very low. As you might remember when we did this the last time, the difference between one person infecting one person and one person infecting 2 people can be thousands and thousands of cases in a matter of weeks. So we've tracked this very closely. This is based on data by the Tulane Critical Care Group. There's a lot of groups looking at this. They're doing it fairly reliably and are kind enough to provide us with their data. You know, it is a little bit concerning to me. These numbers, these R0s, are based on data that's a few weeks old, so it's not real time. It's as close to real time as they can get and process. I would really like to see us below 1. The difference, 1.05 might not sound like a whole lot. Over the course of time, though, that's several hundred more cases and more deaths that could be avoided. How do we get the R0 down? It's social distancing, hand washing, wearing face coverings, limiting crowd sizes and gatherings, all the same things we're doing. So the more we can keep that up, the closer we'll be to keeping the virus suppressed. So we're 2 weeks into phase 1. We're doing well. We continue to meet all the gating criteria, and that is really cause for celebration. But there's a big caveat. We don't know yet. We don't have enough time to know the effects of reopening. I know that the state is working on their phase 2 plans. We're actively involved in that, and they might choose to move into phase 2 by the end of next week. That would be 3 weeks from the beginning of phase 1. In my opinion, that might be a little bit premature. And remember, we've always said that New Orleans has to be more careful because what happens regionally affects us more than it does a lot of other places. Not just regionally within Louisiana, but regionally within the Gulf South. So if we are more restrictive, it's because we want to give ourselves as much data as possible. We understand that being more restrictive is a challenge, and so we need to balance that with the economic realities. But just to sort of put it out there, that's why we're working with the state. Much of what they're proposing in phase 2 is very well grounded in guidelines, but we want to make sure that we move into it at the right pace. One of the things, if you want to go back real quick, I meant to mention at the beginning, as we've been in phase 1, as we put out the guidelines, there's a lot of nuance there. We've had to make some minor clarifications to some of the language in our guidelines. That will be coming out later today, so you can look at that. Mostly what that's focused on is just helping to give better guidance in certain things that we want to prevent. The main goal of what we want to prevent both in phase 1 and phase 2, and really until we get a vaccine or herd immunity, is the concept of these super spreader events. What we're learning about the virus now is that probably 10 to 20% of individuals cause 80% of or more of the virus transmission. And that's because these are individuals that were at high-risk events and spread it widely. It's much less of an individual person-to-person, although that does certainly cause a number of cases, particularly within contacts. So everything that we are doing now, everything that we'll be doing in phase 2 is to avoid the likelihood of one of these large gatherings. We're talking about weddings, funerals, events, live entertainment, live music, not just from the gathering itself of the live music, but we know that choirs can be super spreaders. Being in a choir, singing with a number of people together can spread the virus very easily. Any sort of large event where people gather and cannot easily be separated 6 feet apart. This is what's happening all over the country. This is why you see festivals all over the place continue to be postponed, because these events right now, from what we know, are just not safe. Next slide. So, as I said, we are working with the state. We're very interested to know where they're going to go in the next week. But I want everybody to be aware of why we might be a little bit behind what they decide to do. Number one, you see it right in the middle. I think that's a NOLA.com advocate picture there. Pensacola Beach on Memorial Day. There is no social distancing. This kind of site gives public health folks, a whole lot of heartburn. I don't know how many New Orleanians went to Pensacola Beach, Gulf Shores, Bay St. Louis, but I know it was more than a few. I was really excited, as most of us were, to see in the city of New Orleans around Memorial Day, there really were not a lot of gatherings. People took it very seriously, and that was a huge relief. But we know that an event like this has the potential to spread widely. Many of you have probably heard of the pool party in Arkansas and the Ozarks, where one person spread it to multiple people, several of whom got very sick. That's the setup there. So we really do want to have some more time to understand what the result of that holiday weekend was. As I mentioned, there's some more testing programs coming online with LDH. They have established strike teams that are going to go in and test all of our nursing homes. We had been testing them, sort of here and there. It was very difficult to get enough testing to do, but now they're going to be testing nursing homes. I expect that we'll probably see more cases just because of that. It's very different from more cases in the community. We want to know our nursing home cases. We have to test them regularly so we can control and contain that. And we have mechanisms in place, like the convention center facility, to do that. But it may contribute to a spike in cases, and we need to make sure that those nursing home cases are not spilling into the community. In addition, with additional testing resources that we're getting from the Core Foundation and also from the Louisiana Department of Health and State National Guard, our plan is to make a huge push to test all of our essential workers who have been supporting us throughout the front lines since this began, but who are at higher risk because of their frequent interaction with the public. So we're talking about grocery stores, hardware stores, pharmacies, things that have been open for quite some time. We are also planning to test our returning hospitality workers because, again, we know that they are critical to our economic recovery, and we want to keep them safe. We also want businesses to feel reassured that they can safely have a workforce and serve dinner to residents and visitors alike. We plan to focus on businesses that offer paid sick leave to their employees because that is the most effective way to prevent the spread of disease in a business, and we do not want a worker to have to choose between not being able to go to work and not making a livelihood because they get a positive test result. So there'll be more to come on that. We're very excited about it. We think this is an area that has been overlooked as we focused on all of our high-risk individuals, and these are the workers that we need to protect as we reopen more. Next slide. So I'm not going to, as the mayor says, it's the data, not the date. I don't want to give a timeline for phase 2. I am hopeful that it will not be long behind the state. If our numbers continue to trend, if we do not see huge spikes from Memorial Day or from increased nursing home testing that spills into the community, or if any of our community sites do not show us a big spike, but it will be slow and measured. We review this information multiple times a day in multiple different ways. So we are constantly looking for blips in the data. Where is a hot spot? What are we not thinking of? What are we not doing? We are actively planning for what a phase 2 might look like and hoping again to model the state as much as possible as long as it makes sense for New Orleans given our highest burden. You know, our goal is to continue to protect the most vulnerable, the elderly, those at highest risk of hospitalization and death, while safely allowing the rest of us to have a more normal existence. We will be wearing masks, we will be social distancing for a very, very, very long time. And so the question will be, how do we bring an economy back online knowing that we have those limitations? So that's our challenge. We're doing well. I'm encouraged. I hope that I'll be able to get up here in a few weeks and announce our movement forward. But I wanted to make sure everybody understood where we were coming from. I'll stop there. I've talked a lot. If anybody has questions, I'm more than happy to answer questions.
From looking at this last slide,
Mhm.
from maybe a thing or two you said during the presser, are we to expect that New Orleans will in no way, shape, or form hit phase 2 June 5th?
I think it would be unlikely because that would be 3 weeks after the day we opened. And so it's hard to say, that one day doesn't tell the whole story. I think we would feel more comfortable having 2 to 3 weeks after Memorial Day, because we knew if we're worried about super spreader events, we know that's probably the most likely super spreader event. I mean, I haven't seen big gatherings of people in the city, but that was a big gathering. So 2+ weeks there, if we're still doing well, then that would be a time to think about pulling the trigger. Yeah.
Given that the state will be making a decision about phase 2 next week, are there concerns given how long it's going to take for both the initial phase 1 cases to show up and Memorial Day cases to show up about what reopening in other parishes might mean for New Orleans?
Yeah, I have great concern for our neighbors. I know that every parish leadership is really figuring out what works best for their parish and trying to balance, the economic recovery with being safe. But I have concerns. I hope that they're not founded, right? I hope that we find that we didn't have a whole lot of people going to beaches, or if they did, they were very safe about it. And then we can all move forward together. But, like you said, like you brought up, what happens in a neighboring parish affects Orleans, and what happens in Orleans affects a neighboring parish. So.
I also wonder whether there are concerns about not people that have been infected the first week of phase 1, but people that they would have gone on infected. It seems like, as you mentioned, we don't really have all the data that might be needed to make that decision.
Right, and it's hard to know. How long of a time do you give, right? You can wait too long, and then the economic consequences cause public health consequences which outweigh it, right? And so what we're really looking for is that sweet spot where we feel like we have enough data built up over a reasonable amount of time that if we were to start even seeing the beginning of a spike, we would see it, but that we don't wait months and months for a spike that's maybe not going to come. So we're just trying to really thread the needle there. And again, it's a little bit of art as well as science.
Have you identified any hotspots in the city?
So no specific clusters, no specific, other than we do know, and this is true nationwide, that our nursing homes have been clusters. This week, we, in partnership with Core Foundation, are testing all of our major homeless shelters. I don't have that data back yet. That will be very interesting to me. I'm hoping that we don't have clusters there, but that will be very interesting to understand. We, at our mobile testing sites, we continue to see very low positivity rates, except for our Hispanic community, which we've talked about a lot. So we are doing a lot of outreach in multiple different ways to try to engage our Hispanic community, to make sure that the messaging is getting to them in Spanish and through proper channels and by trusted messengers, and to make sure we have more testing opportunities for them so that we can really get their numbers down. So that's really, it's not really a hot spot in terms of geography, but that is a population of concern. And this is true all over the country. Many, many cities are seeing their highest rates in their Hispanic communities. Okay. Thank you guys very much.